Hi friends, good evening and welcome back to my channel Mukambika Nursing. Friends, we are discussing ESIC previous year questions and answers. Till now we completed 7 parts. Today's video we can see another set of previous year questions and answers. Some important questions also are included in this video. It will be useful for your coming exam. We can see the questions. First question, a patient is being treated with tablet digoxin for supraventricular tachycardia. What signs and symptoms are indicative of digoxin toxicity? Options: option A convulsions, option B yellow vision, option C vertigo, option D muscle cramp. Here the question is, patient is taking digoxin for supraventricular tachycardia, and the question is, what is the sign of digoxin toxicity for this patient? That is the question. So correct answer is option B, yellow vision. Here we have to know what is the adverse effect of digoxin. So we can answer the question easily. The most common adverse effect of digoxin include anorexia, nausea, vomiting, diarrhea, and mainly visual disturbance is one of the main signs and symptoms of digoxin toxicity. Visual disturbance means blurred vision or yellow vision. In our question, yellow vision is there, so that we can choose as correct answer. Also, neurological depression may experience the patient also dysarrhythmia and decreased heart rate. Okay. Move on to the next question. Sinus bradycardia is seen in options: option A athletes, option B anxiety, option C hyperthyroidism, option D fever. Question: sinus bradycardia is seen in, and the correct answer is option A athlete. Sinus bradycardia is also known as, or the other name of sinus bradycardia is athletic heart syndrome or athletic heart or athletic bradycardia or exercise induced cardiomegaly. This occurs due to slow sinus rhythm with an arterial and ventricular rate below 60 beats per minute. Okay, heart rate is below 60 beats per minute. That is also important point. Move on to the next question. If medical treatment fails, which of the following invasive procedures is necessary for treating cardiomyopathy? Options: option A cardiac catheterization, option B coronary artery bypass graft, option C heart transplantation, option D intra-aortic balloon pump. Here the question is, the patient is not responding to medical treatment, then what is the invasive procedure is necessary for treating cardiomyopathy? Answer is option C heart transplantation. Heart transplantation is the permanent choice of treatment in cardiomyopathy for a good prognosis. Move on to the next question. A 3-year-old child had cardiac catheterization. The nurse should include the following in care plan. Options: option A monitor for responsive to general anesthesia. Option B bed rest for 24 hours. Option C NPO for 12 hours. And option D observe for severe pain and medicate as needed. So our question is, a 3-year-old child undergone cardiac catheterization. As a nurse, what care among this option, which care she should include it in the care plan? That is the question. So correct answer is option B, bed rest for 24 hours. We have to know the aftercare of cardiac catheterization, so we can answer this question easily. So after the procedure, we have to give strict bed rest to the patient at least 6 to 12 hours. Okay, and also head of the bed should be elevated not more than 30 degree. Okay, head of the bed should be elevated at 30, not more than 30 degree, and also the extremity should be extended for 4 to 6 hours. It is mainly to prevent the bleeding, and also we have to encourage fluid intake mainly to promote the excretion of the dye which is used for catheterization. During cardiac catheterization, a radio-opaque dye will be used that will be excreted through the urine. Okay, so here answer will come option B, bed rest for 24 hours. At least minimum 6 to 12 hours we have to give. So bed rest for 24 hours we can provide among this option. And first option, monitor for responsive to general anesthesia. Usually this cardiac catheterization is not giving in general anesthesia. It is under local anesthesia. Okay, it is not correct for this question. The next question, to evaluate a patient condition following cardiac catheterization, the nurse will palpate the pulse. Options, option A, in all extremities, option B, at the insertion site, option C, distal to the catheter insertion, option D, above the catheter insertion. After cardiac catheterization, the nurse will palpate the patient pulse in distal to the catheter insertion. Here option C is the correct answer. Distal to the catheter insertion. Move on to the next question. Intraosseous drug administration is typically used when the child is. Options, option A, actually ill under age 3. Option B, actually ill over age 3. Option C, critically ill and under age 3. Option D, critically ill and above age 3. Question is, intraosseous drug administration is used when a child is critically ill and under age 3. Option C is the correct answer. In case of critically ill child, which other method of administration are not possible, then we can use intraosseous injection for a child under the age of 3. Option C is the correct answer. The next question, which is known as universal donor? Option A, O negative, option B, AB negative, option C, O positive, option D, AB positive. Universal donor is O negative. Option A is the correct answer. The universal blood group is AB positive and O negative. O negative is the universal donor and AB positive is the universal recipient. Move on to the next question. Contraction stress test is also known as. Options, oxytocin challenge test, option B, stress test, option C, both A and B, option D, none of this. Contraction stress test is also known as oxytocin challenge test. Option A is the correct answer. Contraction stress test. And the next question, at 8th week of gestation, uterus looks like. Options, option A, small unripe pear, option B, large orange, option C, size of a grapefruit, option D, golf ball. At the 8th week of gestation, uterus is look like a large orange. Option B is the correct answer. Move on to the next question. The milk secreted 2 weeks after delivery of the baby is known as. Options, option A, colostrum, option B, mature milk, option C, transitional milk, option D, fore milk. The milk secreted 2 weeks after delivery of the baby is known as mature milk. Option B is the correct answer. The first milk which is secreted is known as colostrum. Colostrum is the first breast milk, and the milk which is secreted 2 weeks after delivery is known as mature milk. Option B is the correct answer. The next question, which of the following hemoglobin value denotes anemia in a pregnant woman? Options, option A, HB 10 gram per deciliter, option B, HB 11 gram per deciliter, option C, HB 12 gram per deciliter, and option D, HB 13 gram per deciliter. Correct answer is option A, HB 10 gram per deciliter. According to ICMR, that is Indian Council of Medical Research, considered hemoglobin below 10.9 gram per deciliter is considered as anemic during pregnancy. And the next question, Accumulation of pus in the fallopian tube is known as. Options. Option A salpingitis. Option C pyosalpins. Option D hydrosalpins. Option D hydroophins. Accumulation of pus in the fallopian tube is known as pyosalpins. Pyosalpin means pus formation in the fallopian tube. Salpingitis means inflammation of the fallopian tube, and hydrosalpins means water, accumulation of water. The next question, intermittent claudication is a sign of. Options. Option A arterial occlusive disorder, option B nerve injury, option C peripheral neuropathy, and option D myocardial infarction. Intermittent claudication is a sign of arterial occlusive disorder. Intermittent claudication means is a cramping pain in the leg muscles due to atherosclerosis or due to any occlusive disorders. Here, arterial occlusive disorder is the sign of intermittent claudication. The next question, which of the following drug is withheld if the patient pulse is less than 60 per minute? Options. Option A digoxin, option B dopamine, option C dobutamine, option D phenytoin. Usually, which drug is not given if the patient pulse rate is less than 60 per minute? Correct answer is option A digoxin. So we have to check the pulse rate before giving digoxin, and if it is less than 60 per minute, then we are not giving digoxin to the patient. The next question, which electrolyte deficiency may increase digoxin toxicity? Options. Option A calcium, option B sodium, option C potassium, option D magnesium. This is one of the important question. So it was asked in many other exam also. Okay, so the correct answer is option C potassium. The electrolyte potassium deficiency may increase digoxin toxicity. And the next question, raising the foot end of the bed of a patient with chronic venous insufficiency will help in. Options. Option A preventing edema, option B improve circulation, option C provide comfort, option D venous drainage by gravity. Question, raising the foot end of the bed in a patient with chronic venous insufficiency will help in venous return or venous drainage by gravity. If the option venous return is there, means that also correct. Here venous drainage by gravity is there, so that is the correct answer. Here I have bought previous year questions from ESIC question paper. So what you people have to do is, you have to read related points and related topics you have to study. Then only you can gain more knowledge. Okay. Study well. We can continue next set of questions in the next video. Thank you for watching my channel. If it is useful for your studies, please subscribe my channel and support me.